Now we're going to cover the proper use of inhaled medications. Your most common is your meter dose inhaler, or MDI, like your albuterol. This may look different than what you have in your community because these are placebos, so it's white instead of that blue color. There are two ways they can take it. I'll demonstrate both methods for you. Encourage the residents to take a few deep breaths ahead of time, so have them breathe in and out, emptying their lungs all the way. So we're going to shake it. Hold it about 2 inches or 3 finger spaces away from your mouth. When we breathe in, hold their breath for 10 seconds and then breathe out slowly. Now, how many residents can do that? Let me guess, none of them. The other method again is with your teeth around it. So we're going to shake it, have them breathe in and out, emptying their lungs all the way. Put their teeth on the inhaler, breathe in, hold their breath for 10 seconds, and then breathe out slowly. The reason you need to hold your breath is so that the medication has a chance to get into the different regions of your lungs, because your lungs are huge. Believe it or not, if you were to take them and spread them out flat, it would cover a tennis court. It's a lot of surface area for those 2 puffs to cover. So if they are not able to hold their breath, there's a couple of things you can do. You can either have them do what's called terse breathing, where if they can only hold their breath for, let's say, 4 seconds, instead of having them breathe out going, have them stagger the breath going, and what that terse breathing does is it contracts the muscles around your lungs and helps push the medication in down deeper. If that still isn't working, we have our handy dandy spacer. What's nice about the spacer as well is they can make a tight seal with their mouth around it. They can also press and then wait and breathe in. If we don't have the spacer, they need to press down and breathe in simultaneously, which can be difficult for some residents. So with the spacer, they can just breathe in slowly, have them hold their breath, and breathe out. The key with the spacer is to make sure they don't breathe in too quickly. This spacer is designed to whistle if they're breathing in too fast, so this is what you'll hear. It'll be similar to a harmonica. There's a lot of residents who think that that noise is good when it's actually the opposite, so encourage them, it should be silent. If your residents are still struggling, with the spacer, they're just not able to hold their breath, there is another attachment you can put on here that makes a tight seal over around their nose and mouth. And with that adapter, they don't have to hold their breath for 10 seconds. They can just press it down and breathe in and out normally about 4 or 5 times and get the same benefit. The first mistake people have is not emptying their lungs enough. If you don't breathe it out, you can't breathe it in. So that's the first mistake people make as well when breathing it in, is you want to take in air with it. And so people will make a nice tight seal with their lips around the inhaler, and that's actually incorrect. What I see most residents doing, especially in assisted living, when someone hands them their inhaler, is this. And you see the mist going everywhere. So we want to really avoid that, because if that's what your residents are doing, there's really no point in them even getting the inhaler. They're not getting the medications. They're not going to treat especially those lower lobes of their lungs.